6. Second study, more numbers, 12,000 radical prostatectomies with glycine up to 6. The risk of prostate cancer deaths was 0.2%. So only 2 patients per 1,000 patients had some risk of prostate cancer. And those authors, they came back to those histology specimens, they take a look and they found some part of glycine 4 pattern, which means that it was not real pure glycine 6, it was glycine 7, 3 plus 4. Nowadays we have a bright new technologies like multi-parametric MRIs. We are looking for PSA and new prognostic markers. Soon I'm sure multi-parametric MRI will substitute biopsy. So it's definitely a new step towards new diagnostic tools in the field of prostate cancer. And when we are going back to treatment, so classically we had radiation and surgery for the low and intermediate group, and hormones for more aggressive or more advanced stages. Then we have this new risk stratification. We have the appearance of new technologies, of new treatment algorithms. And for example, we have focal therapy right now, which is very actively used for low grade, like lasers and cryotherapy. And we have protocol of active surveillance, which is also covering the first early low-risk disease. And those radiotherapy and surgery and hormones, very often in the complex of multimodality treatment, they're moving more towards high risk of the disease. So for those high and very high group. And when we're talking about surgery specifically, because we are having here the surgical congress, we're talking about 3 major approaches to the prostate or radical prostatectomy. It is open approach, it is laparoscopic approach, and it is robotic approach. And we have this very nice critical review from the high volume centers. So they basically took the very huge specialists who are the best in their field of robotic, open and lab, and they published this big trial and find out that there is no big difference between those 3 approaches. And in conclusion, they found out that yes, there is definitely a benefit of minimally invasive surgery, of lab or robotic in terms of blood loss. But in the end, they write down such phrase like, however, the lack of randomized trials precludes definitive conclusions. So in the era of no randomized trials, we were looking at this paper. Nowadays, we are having the paper coming from Australia. It is an only randomized trial comparing robotic radical prostatectomy versus open prostatectomy. They take a look on early postoperative outcomes at 6 and 12 weeks after operation. They take a look on continence rates, sexual function, perioperative complication rates, and they found, as you already saw, no difference. They write down this phrase: we encourage patients